I ought to say that I work for NHS London, and it's my job to keep that overview on all of the trusts in London that are likely to be going through a merger, basically. I've been doing that for about a year. My background, though, is in hospital management. So before doing this present role, I was Chief Exec of a hospital in North East London, and before that, Chief Exec at the Royal National Orthopaedic Hospital in Stanmore. And my background is working in hospitals across London. And I say that because I'm coming at this issue, this question, about how does the trust get to become a foundation trust, from the point of view of what is best for the hospitals, what's best for the patients that are served by those hospitals, and what's best for the staff as well who work for them. So the question up here is, why can't the trust become a foundation trust in its current form? This is a question actually that the trust board here at Epsom St Helier has looked at in some detail and did a lot of analysis on this last year. It set up a working group in the summer, and that report came back to the trust board in December. And the area that they particularly drilled down to in a lot of detail was the financial plan for the future, and particularly compared the plan with the test that Monitor, the independent regulator that Matthew described, the test that Monitor apply for every NHS trust before they can become a foundation trust. And it was that test around financial viability that this organisation in its current form was unable to actually achieve. Now that might seem rather strange, bearing in mind, and as Matthew has pointed out, the trust has actually met its financial targets. Of course, what Monitor does is it looks at the future. It looks at 5, 6, 7 years ahead. And that's where the trust found difficulty in demonstrating that it was financially viable. One of the very relevant factors, not the only one, but one of the very relevant factors here is that primary care trusts, who are the commissioners, they're the funders of hospital services, as you know, the primary care trusts in these areas are quite financially challenged, and that has an impact on this organisation, as I'll show you in the next slide. I won't go through all of the figures that I put up on this slide, and I ought to say actually I'm not an accountant, but I can assure you that there were a number of expert financial accountants who looked at the detail of this. But NHS Surrey certainly has a significant financial challenge ahead of it, as does NHS Sutton and Merton. And the impact of that is that they have less money to spend with this organisation than perhaps we might previously have expected for the trust. What this means is that it sets a financial challenge for this trust to make savings year on year to actually balance its books. So in December, when the trust board looked at this, it looked at that financial outlook, it looked at the future over the next 5, 6, 7 years, looked at the income assumptions, what could be achieved in terms of savings, and the conclusion was that it was not possible to do all of that and meet the Monitor requirement for a financially sound organisation. And you put that together with what Matthew's described, which is the real benefits of being a foundation trust, that is a problem. It means that there isn't at the moment a path that gets this organisation to become a foundation trust. So, the board then decided, so how do we move forward from this? And it set up what we've termed a transaction board. Jan, who's introduced this, is chair, myself as senior responsible officer, and a number of other people working on this to actually come up with an answer to the question, how do we get the hospitals run by this organisation into successful, viable foundation trusts. We've got various work streams identified working with staff within the organisation, with our key stakeholders. It's not just NHS London as the Strategic Health Authority that's engaged in this, NHS South East Coast as well. We've got the commissioners, and very importantly we've got GPs working with us on this as well, so that we can make sure that we get the best solution for the hospitals. And there's some very specific guidance that we've got at NHS London about how we should go through this process. So what are the possible options, and what do we mean when we talk about a transaction here? Well, there's a range of options, and I think the first thing to say is there is no decision taken yet. We are going through a process to reach a conclusion. Clearly one of the options, just looking at this slide up here, is that Epsom and St Helier stay together and join with another NHS Foundation Trust to create a larger foundation trust. That's a possibility. An alternative is Epsom and St Helier stay together and join with an NHS Trust and subsequently put in an application to become a foundation trust. So that still gets you to the end point as well. Alternatively, Epsom separates from St Helier and each of the two hospitals goes in with a different partner. That partner could be an existing foundation trust, it could be existing NHS trust that then applies to become a foundation trust. All of those options are open at the moment. My personal view at the moment is that I think it is most likely that we will see a separation of Epsom from St Helier. And the reason I say that is that if you think about possible partner organisations, they are more likely to say, well, because of our locality, we're going to be more interested in Epsom, or we're more interested in St Helier. So we keep all options open at the moment, but I have to say I think the most likely outcome is a separation, and then it's a question of finding the best partner for both Epsom and St Helier hospitals. One point I ought to just emphasise is that in looking for partners, we are limiting our search to just NHS trusts and just foundation trusts. There's been quite a bit of talk nationally about the private sector involvement. Our aim is to get both hospitals within an NHS foundation trust. So that's why we're looking for NHS partners. We wouldn't rule out a foundation trust entering into a partnership with a private sector organisation if that would help, if that would support. Perhaps, for example, helping to find capital for a rebuild. But our primary discussion is with NHS bodies. So where are we at the moment? This slide is actually just a very top-level outline of the timetable that we're following. We've, as you might expect, got a very detailed action plan below this. At this stage, we're inviting expressions of interest from interested NHS bodies, NHS trusts or foundation trusts. And they have to fill in a pre-qualification questionnaire, that's the PQQ that's listed up here, to say what their level of interest is. They have to say whether they're interested in both Epsom and St Helier, or just Epsom or St Helier. I'm not, I'm afraid, at this stage able to list which organisations have expressed an interest, because we're right in the middle of evaluating those as they're coming back. Although I do hope the next time we have a public meeting shortly, we will be able to do that, and I know Jan will talk about future arrangements for public meetings in a minute. What we will aim to be doing, though, of course, is identifying, then evaluating those bids as they come in, to work towards the best preferred partner for both Epsom and St Helier. And it says on this timetable, October 2011, October this year, evaluate tenders and make final decisions. I think when we say final decision, at that stage, that will be, we've now identified what we believe to be the best partner for Epsom Hospital, the best partner for St Helier. There's clearly a lot more detailed work that would then need to go on, which will include consultation with key organisations, it will include consultation with staff, and everything that has to be put in place to make sure that the merger could go ahead and be delivered in a way that doesn't get in the way of continuing good patient care, and it's got to be delivered in a way that also enables the organisations to maintain good financial control as well. So there's a lot of detailed work needs to go on. And the aim would be to complete the merger or mergers during 2012. There may of course have to be a subsequent phase, which is a foundation trust application. It depends on the nature of the solution. But that does still allow time to achieve foundation trust status for both hospitals by April 2014, which is our target date. We will move as quickly as we can with this, but of course there is, we must go through due process. We must allow enough time to involve the key people, and particularly around consultation. But we are conscious that when you're talking about a merger, it is very destabilising and unsettling for people. So we do want to move on as quickly as possible with that.